So now we're on to health, disability, and long-term care insurance. So in the United States, we have the highest per capita medical expenditures of any country in the world. What kind of insurance health care coverage do we get for that high cost? It's debatable. So again, the average per capita cost for healthcare, and this was in 2019, significantly higher today in 2025, was $11,670. Again, per capita cost, per person cost per year was $11,670, and the amount is twice as high as much as other healthcare coverages for the 24 industrialized countries in Europe and North America. And again, it's debatable. Some of these things are, but it's a point. The point being that our healthcare is not an inexpensive proposition, right, in the U.S. So again, in 2019, it amounted to about 20% of our GDP, a gross domestic product, and it's probably similar today. Along those lines, might even be a bit higher and expected to grow again more as our population continues to age, if you will. Higher administrative cost, et cetera, and interesting things at the moment when we start talking about health insurance and healthcare coverage and the cost, rising. And so as comparison, our healthcare dollar, we spend 11% of our expenditures are on healthcare. In Canada, it's about 1%. And again, are we getting as much bang for our buck? Is it as efficient as it should be or as it could be? Certainly not. But are we getting more than the Canadians are getting? And just on its face, of course, you'd have to say yes. Is it much better? Again, debatable. So we're using much more sophisticated, expensive technologies. Duplication of tests and technologies are happening very, very frequently, where people get blood work all the time and lab tests and so on and so forth, and increasing longevity of elderly people. People are living longer in general. I know we've probably had a decline because of COVID, but in general, people are living longer than otherwise would have been the case in the past. With different chronic ailments and cancers and so on and so forth. Regulations also cause that cost shifting rather than cost reduction, moving the cost around, increasing the number of accidents and crimes that require emergency medical services. Again, that's something that it's kind of hard to avoid. More people, you're going to have more accidents, more involvement that way. Limited competition and restrictive work rules in the healthcare delivery system. Labor-intensive and rapid average earnings growth for healthcare professionals in general. A doctor can only see so many people. A healthcare provider can only take care of so many patients in a given period of time. It's not something that you can scale up easily. But again, these things they're working on it, if you will, especially when you start considering such things as artificial intelligence and the diagnostic capabilities that are out there today versus what were out there in the years past. So using more expensive medical care than necessary is often the case. Malpractice, insurance, and fraud is a component of this as well. Again, built-in inflation in healthcare delivery system, and once again, aging baby boomers, and that's a self-correcting problem. As they get older, they start to fall away, as in die, right? But I'm part of that group, so I can say that. At any rate, a lot of different factors a lot of different things that factor into the higher cost of medical costs that are out. So having said that, there are a variety of ways that we can reduce our medical cost on a personal note, if you will. There's flexible spending accounts, where you're paying with pre-tax dollars for your medical care, your deductibles, your copays, et cetera. Considering higher deductible healthcare plans, health plans that would it's not to say that you're avoiding healthcare altogether, but thinking about it rather than just automatically going. If there's no charge, then go take advantage of it, right? No, in this case, if you're paying for some of it, at the very least out of your own pocket, then you're going to be much more cautious about that, using generic drugs as opposed to brand name drugs, ordering a mail order 90-day supply versus then going to your pharmacy for a 30-day supply. Low cost coverage for uninsured children through a state, reviewing all these different things, Medicaid and so on and so forth that are available for children, reviewing state plans for prescription drug assistance, using there are different online resources as well for getting reduced prices, and the list just goes on and on. Reviewing your statements for errors, appealing unfair decisions, practice preventive care on your own as much as you can. Stay well, right? Eat balanced, don't avoid smoking or not drinking to excess. Watching out for your health. All of these things that you can do to help reduce your cost, your healthcare costs, you're on a personal note. So the purpose of health insurance is to reduce the financial burden placed upon a person that is suffering from illness or injury, really is what it comes down to. And so it's part of your overall insurance program to safeguard. So it's not just casualty insurance, homeowners insurance, liability insurance, bodily, and also liability for property, etc. It would also include your healthcare insurance. So it's all part of your overall insurance program, if you will. So it includes both medical expense insurance and disability income insurance and a variety of other things that can kind of come up into play, and we'll walk through. So the next thing we're looking at is evaluating the different private sources of health insurance and healthcare. Group health insurance plans comprise about 90% of all health insurance. So going through a group, through employer sponsored, employer pays part of it, the cost, etc. And the TCJA, again, that requires large employers, more than 50, to provide health insurance coverage to all employers. This was actually part of Obamacare, but at any rate, it would have also been part of the TCJA. So in 2018, the labor expanded access to affordable health care options for small businesses and employers through association health plans, or AHPs. The HIPAA laws, the Health Insurance Portability and Accountability Act of 1996, it also guarantees renewability so far as health insurance claims, plans rather, being able to make sure that you can be insured kind of going forward. So individual plans could be an adjunct or an add-on, if you will, to your group insurance. So coordination of benefits that would result from that, so that you cover more of your expenses and more up to 100% of the allowable expenses. Different add-on plans that are always available. Medical coverage, after divorce would be such things as through, COBRA plans where you're paying the cost, the full cost of the insurance, plus an administrative fee. Can be very expensive, but oftentimes you need to have this coverage, so it's good to have that option available to you. Different types of plan, health insurance plans should include, again, offering basic coverage for hospital and doctor bills, provide at least 120 days hospital room and board, provide at least $1 million lifetime maximum for each family member, pays at least 80% out of pocket hospital expenses after annual deductible of $1,000 per person or $2,000 per family, and those numbers have gone up a bit, but roughly speaking, would be that deductible piece, and imposing no unreasonable exclusions and limit out-of-pocket expenses to $4,000 to $6,000 on an annual basis, right? Just some basic ground rules, if you will. So hospital insurance covers the hospital room and board and other charges. Surgical expense insurance covers the surgeon fee for operation and also the follow-up visit. The physician expense insurance pays for physician care such as office visits, lab tests, x-rays. It does not include surgery. So these are separate areas so far as that health insurance is concerned. Again, hospital expense, surgical expense, and then physician expense. Major medical expense insurance covers expenses for serious injuries or long-term illnesses, and it's added to that basic plan. These all have deductibles, coinsurance, and stop-loss provisions. Comprehensive major medical insurance, low deductible offered without a separate basic plan, covers hospital, surgical, medical, and other bills. That's comprehensive, all-inclusive, if you will. Hospital indemnity policies, pays cash benefit when hospitalized. Dental expense insurance covers exams, cleaning, x-rays, etc. Vision care, exams, contact lenses, glasses. Other insurance policies would be such things as dread disease, trip accidents, cancer policies, and they focus on unrealistic fears, meaning, you know, they're just an added expense where they're poor value, meaning that it's just not worthwhile to do these things, really is what it comes down to, these dread disease type of accidents. But trip accidents, that's again, things happen, and your insurance covers most of these things, and to the extent that they're covered, that's as much as you really should be concerned with. Okay, so breaking out your responsibility for insurance, the deductible and coinsurance. So for example, this is actually a good example. Ariana's policy includes $800 deductible and coinsurance provision requiring her to pay up to 20% of all bills. If her total is $3,800, for instance, the company will first exclude the $800, so you're paying that off the top. That would be the deductible. We'll then pay 80% of the remaining $3,000 or $2,400. Therefore, the total cost for Ariana would be the $1,400, $800 for deductible and $600 for coinsurance. And then keep in mind that there is a total out-of-pocket amount for the year. If you hit that amount of, again, $4,000 to $6,000 typically is what the insurance plans are at. This is a while ago, and it's probably still about the same today. Long-term care insurance. This is for people that, again, that have to end up in like a nursing facility, nursing home, etc. And it can be very, very expensive. So national average of 1 year coverage in a nursing home was $97,000, and this was a few years ago. So now we're probably looking in excess of probably somewhere in the order of $10,000 a month, typically for full coverage for nursing home coverage. You know, it can be a very, very expensive proposition. So these are some things to consider. Even when you're young, you consider these things because you're going to get older, and the sooner you buy insurance, the younger you buy insurance. Oftentimes, I'm not saying to go out there and get it, but it's something to consider. The lower your premiums tend to be when you buy in early on a lot of these policies.